What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video, we're covering X-ray tech student experience in clinicals, big hospital versus large hospital. So to give you context, I'm a night shift X-ray tech, been doing it for 4 years. Work a lot of day shifts, so I do dabble in overtime in both worlds. And I remember when I went to clinicals as a student and I got to go to both spectrums, to like the biggest hospital, which I'm currently working at, to the little ones. So I would say, like, we'll start off with the small ones. Okay. So in the small ones, typically you'll just have like the radiology department, the ER, and like maybe just like labs. And we have ultrasound, MRI sometimes, mammogram sometimes, nuclemed sometimes. But for sure, it'll be either there's a CAT scan tech and an X-ray tech and ultrasound tech. Sometimes the X-ray tech is the CAT scan tech, so they do both. I've seen that happen also. Overnights, especially overnights, they're going to be doing both. And then I will say like that it is really, really paced slow. Most of the times you'll have a few X-rays that come in the morning from like patients who do out like the outpatient buildings. I would say maybe 10 of those would come in throughout the day, usually in the morning time. And then you would have the emergency room, which I think our emergency room was about 6-7 beds. It wasn't that much. And it was like tiny. There was like only one doctor and like 3 nurses. It was not that big. And then I think we would average maybe 1 to 2 X-rays an hour. That's not even that much. Majority of the time we'll end up just doing them and then just be there catching up on like all my reading for the college, the textbooks and stuff, or like asking questions to the techs, or like simply just restocking, or just like kind of wandering around trying to see what they have in the department, just to learn and stuff like that. Compared to like the other side and the hospital I work at right now, it is very big, always something to do. We average way more X-rays. I think like during the daytime right now that I'm working daytime, we average like between, what would I say? It depends on like in the morning, it'll start pretty slow. We'll probably have like 5 to 8 X-rays. And then it'll taper up to like 10, 15 to 20. And then at some point you just quit losing track because they just comes in and you're just churning and you're just like knocking them out and beginning them, starting them, and you just kind of lose track of how many you've done. But here in our department, like, if you do X-rays, you just do X-rays. If you just do CAT scan, you just do that. You may be able to dabble in both, but it's not your main profession. You just kind of each one do that. And like a hospital's divided into like 3 different parts. You have like the main radiology where we do all the fluoros. And then we have the patient outbuilding, and then we have the emergency room. I just mainly work in the emergency room. That's kind of where I dabble in my stuff. Because at night shift, we just stay in the emergency room. So that's kind of majority of what I know. So when I pick up extra days, that's kind of where it goes. I would say that there's more techs at the bigger hospital simply because there's more positions to get done. And you can learn more at the bigger hospitals because you can either ask a lot of questions to different techs who've been different places and get different insights, acquire different knowledges. Once again, I've been told by other techs when they were students that certain techs aren't as nice to students, I guess, or they've had bad experiences. I think everyone in my department does pretty good. And here locally kind of does pretty good. But we had a few people come out of state to work at our hospital, and they have different stories when they were students. So, I mean, I would say as long as you are willing to learn and willing to actually do stuff, you should be okay as a student. Yeah, spin your wheel, Miguel. See you on the next one.